Hi, Bother Brigade. Here's what's bothering me today. This is definitely overdue, but a whole bunch of stuff happened with the truckers and all that. But this is the finally and very much long overdue second Canadian pandemic timeline video. We did the one for America like a week or two ago. Now it's time to go back through basically all of January at this point about all the ways in which Canada has failed at containing this pandemic, and also how many of our leaders and provinces have just frankly given up, and why that's not good. However, again, like I mentioned in the American one, there is some actual hope at the end of this, so please watch through to the end, or if you don't have the spoons to watch the whole thing, just skip to the end. But basically, the point is that there is some actual hope here. But before we get to that and the hopium and the ways out of this pandemic, we first need to go through how we got to this point. And so let's just rip the sticker off right now and start with this, which is kind of just a great summation of everything and all the spectacular failures up to this point and afterwards. The inevitable result of working retail in a global pandemic without basic worker protection measures. Yeah, that just about sums it up, where, we, being most of Canada, stayed open throughout the Christmas season because, hey, capitalism got a shop, Christmas, but then we closed, right after. So, and many people still just didn't see their families at Christmas to be on the safe side. But then we shut down. But now we're open, kids are going back to school, and we're going to just explore how all of this has been a monumentally terrible idea. And yes, there's a lot of Ontario focus because, well, that's where I am. But we touch on everything from like BC to New Brunswick. So it's a lot to get through. And that's why, because it's all kind of piecemeal, I've decided to just do the timeline so that people can see how just one terrible decision just leads to another, and so on and so forth, and etc. So with that, I guess we really have to start with January 2nd, because Lord knows nothing happened on the 1st, because that was New Year's. And boy howdy, did Canada ever figure out a way to ring in the new year. We need to keep schools open for students' mental health, say the same people who routinely cut back mental health and disability funding, try to shut down sexual health education, cancel discussion of the concept of consent, and close down all the gay-straight alliances. Yeah, so that was the thing, right? Because when they shut down, announced the lockdown, it was, okay, yeah, kids aren't going to be going back. This is especially in Ontario. And a lot of people were mad. Like, come on, kids really miss school. And it's like, yeah, I know they do, which means we should have gotten everything fixed. And don't worry, we're going to come back to that. But this one in particular is a little annoying to me because, and maybe this is mildly like potentially doxing myself for someone who cares enough to try and figure out the research to go back like 2+ decades. I'm very pissed about the closing down of the GSAs, the gay straight alliances, because I was part of the main push as a student to get those going and then be actually enshrined by the previous, or one of the previous, liberal governments in Ontario. So if you are actually a Gen Zer and you had a GSA at your school, that is thanks to the efforts and advocacy of not just myself, but hundreds, if not thousands, of other students across Ontario, whether they were gay, lesbian, bisexual, trans, or in my case, straight, hence the Gay Straight Alliance, that helped push for this to become a thing. So another, one of the many reasons why I'm just super mad at Doug Ford and the Conservatives is that they've literally undone a ton of advocacy work that I and countless others pushed for to make schools a better, safer experience for, our friends, ourselves, and for future generations. But hey, it's like that Chumbawamba song. I get knocked down, but I get up again. You're never going to keep me down. But anyway, speaking of Doug Ford and Stephen Lecce and the whole school thing in Ontario, this was basically the vibe that a lot of people were getting. So Doug and Lecce are closing schools for 2 weeks in January to do all the safety upgrades they said they did last September. Yep, basically, because that was the thing, right? They said when they first shut down schools in, the previous year 1 or 2 of the pandemic, depending on how you're counting it, they said, oh yeah, look, we got to shut down schools so we can do all these improvements and make it safe for kids to return. And then they did none of that. And of course, that wasn't a bigger part of the media coverage. But anyway, lots of people were mad about that. And then another story that came out on January 3rd was the following, which, I mean, it's not surprising, but it's still infuriating. Ontario Health CEO confirms 8 to 10,000 non-emergent surgeries will be postponed per week under new order. Non-emergent includes heart, cancer surgeries. That will be devastating for many. So yeah, the Omicron spread because, it's mild, even though the unvaxxed are taking up most of the hospital spaces and resulting in stuff like this, and still resulting in the absolutely ridiculous overworking of our already burnt out frontline and essential workers. And now we are seeing that, oh, look, people are now having, like, tens of thousands of people are now having their crucial surgeries postponed, which is likely going to result in deaths. And sadly, we're going to come back to that. But hey, the next day on January 4th, we got some really good positive news. And by positive, I mean absolutely terrible. Dozens of big companies headed by top paid CEOs collected COVID-19 government benefits. That again touches on something we've touched on before on this channel about the CEWS, the Canada Emergency Wage Subsidy, and how that was basically abused by big businesses, including Bell. See the very recent Bell Let's Talk video touching on that whole chestnut. But lots of other companies did the same thing, right? They took government money, aka our taxpayer money, and gave themselves bonuses and like stock buybacks while still firing employees. So, kind of bad. Maybe we should, address that, but we live in a capitalist nightmare, so that's probably not happening anytime soon. But as someone again rather beautifully summed up, the pandemic has been hard on a lot of people, but in 2020, Canada's 100 highest paid CEOs had their second best pay year in history. The system works, right? The common man and woman and child, it's all clearly been so great under this capitalist system, right? That's why the wealthy continue to get richer, including off of free government money that was meant to help us. And, the rest of us kind of just have to sit and deal with the abject horror and terror of existence. Isn't that just so wonderful? Capitalism is the best system ever. Rodney Tory basically says what I'm feeling about the subject when she says that it's depressing to me that after 2 years of a pandemic that's widening inequality and showing the massive gaps in our social net and healthcare, not that more people haven't become anti-capitalists, but that they haven't even begun to question the failures of neoliberalism. Like, yeah, when is enough going to be enough? And people wake up and realize, you know what? The system doesn't work. And we so clearly see it because we've had now 2 to 3+ years experience of just absolute negativity under this system. And it's just all so casually horrifying and like, I want to say insane, but no, that's not the right word for it. But then you have stories like this. So my son was working at the grocer's tonight, heard a phlegm cough behind him, then a hand on his shoulder, turned to see an unmasked man, red-faced, sweating, asking about a product. Why aren't you wearing a mask? Medical condition. Okay, helps find item. Are you feeling okay? No, I haven't worked for a week. Why? Because I tested positive and they won't let me work. Why are you here unmasked and coughing on me? I have to get groceries. It's guys like this that keep us in this shit. A 17-year-old shouldn't have to put up with it. Yeah, gee, I wonder why people are just becoming so tired of the pandemic. And, oh, God, come on, we did the thing and now we've gotten vaccinated, but there's still shutdowns. Like, what's going on? Like, yeah, it's almost like this is a global and more complicated problem. And we have jackasses like that man just going around saying, oh, I need groceries. You couldn't have maybe called someone and said, hey, I tested positive, but I really need groceries. Can someone get these things for me and drop them off at my door, like in the lobby or something like that? Or I'll buzz you in, bring it up to my room. Like, there are definitely numerous and far safer ways around this. But instead, we still just carry on with no, I need these things. So therefore, my very simple rationale for doing this, that's totally fine and not going to have a cascading series of consequences after the fact. And again, right, we're just setting the stage here before, we get into the further nitty gritty of spectacular government failure. Like I said, this is a dark one, but, it's kind of crucial to set the basis up for why things are the way they are, and then the actual hope and optimism and how we can begin to fight back against that. So if you need to take a break, I don't know, look at cute puppies, cats, raccoons, something online. So that depressing story from the son working at a grocery store, that happened on January 6th. Also on January 6th, it came to the attention of many other people that the remote Labrador community of Nain has one nurse not in COVID-19 isolation left to care for its 1,100 residents, says a local community leader. Yeah, maybe it's a problem that we've still allowed this thing to spread unchecked in the interests of business and capital rather than the interests of the people. And it's resulting in already, right? Like by January 6th, we're seeing warning signs of a healthcare system collapse. Again, mostly due to Omicron. So much for it being mild. Which brings us to another reality check on January 6th. Reality check. Children are dying. Neurosurgeries are being delayed. LTC homes are in lockdown. Disabled and indigenous folks are being ignored. But those whose freedom has been stolen are upset over minor inconveniences like gym closures, virtual school, and store limits. Yeah, our freedoms have really been limited according to a great many people in my comment section and my Twitter replies. Because, it's all like, it's no fascism, papers please. It's like, yeah, no, I always feel like I am in such a fascist state when I get carded at the LCBO. It truly is fascism that when I go to buy ammo for range day, I have to show my little plastic card that gives me the permission to buy ammunition. Such fascism, very oppress. But I want to quickly hit on the whole long-term care home thing because that's something that in the early days of the pandemic was a really big story. And people were like, oh my God, what's happening? This is breaking out. And like people's grandmas and grandpas are dying. This is unacceptable. How do things get to this point? For-profit care, which is why capitalism fucking sucks and we need to end it. But anyway, Dr. Vivian Stamatopoulos brought up a really great point when she pointed out on January 7th that 18,000 HEPAs suddenly in the process of being deployed to LTCs. I'm glad it only took 2 years to get this done. 2 years and a flurry of recent angry tweets by yours truly. And not just her, right? But hundreds, if not thousands of other angry and just exasperated Ontarians thinking, we've had how long for this stuff to be done and it wasn't done? Like, what is going on? Again, folks, capitalism and it fucking sucks. Please, I'm begging people, wake up and smell the dystopia. This is not sustainable. And we're going to see more of that in the upcoming weeks as we go through this timeline. Because again, right, the people in charge, whether they're Doug Ford in Ontario or, what's his name, Blaine Higgs in New Brunswick, or John Horgan over in BC, and he's NDP, so like this just shows you how terrible neoliberalism is, and it's infected basically all the parties. But between these premiers and others, you see a very clear point of how, oh, well, we can't stop people from making money because that's good for the economy, right? And then when it comes back to bite us in the ass, people are suddenly shocked and confused that this happened. Premiers in March of 2020, we need lockdowns to flatten the curve. Give us time to build up our health infrastructure. There will be more beds, nurses, everything. And then in January of 2022, yeah, sorry, we, didn't do any of that. Yeah, because, that's expensive and me no likey that because me capitalist. So, we clearly are beginning to see that instead of doing the right thing, they are doing the easy thing, which is to ignore it and hope people forget and hope that the problem goes away, which is not how one actually manages a crisis, oh my fucking God. But one of the ways in which people and governments are trying to ignore this is something that BC and others have been doing. We've talked about this in another previous video when we did the previous timeline that also touched on Ontario ending classroom alerts. Well, guess what? BC is doing that too. BC to end classroom alert for COVID-19 exposures, monitor school attendance instead. If you're wondering why students are organizing protests and walkouts, this is part of it. And again, right, that's in BC under the nominally left-wing or progressive BC NDP party, right? The New Democrats. They're supposedly not very neoliberal, and as we've seen with John Horgan out on the West Coast, definitely not the case, which is why it's rather, telling that people are feeling very dejected by that. But as Bedrino so rightfully points out, we can't vote our way out of this pandemic. You said it, brother. So if they're not just, refusing, like they're just, covering their eyes and saying, oh, if I can't see it, it doesn't exist and it's not a problem, right? There's another problem that's happening where people are just outright lying about the state of the healthcare system and paramedic response, as we saw on January 8th. The paramedics union said there are no units available tonight. This was in Toronto. Last night, when asked if we needed federal help, the city said no, that we are prepared. Watching how things have been unfolding, I am not convinced at all. And yeah, no one should be convinced by this. Someone decided to say, oh yeah, no, we're totally fine in the city of Toronto. They're not. They're not in a great many places, such as the Peel region, which is home to Brampton, a massive suburb of Toronto, as well as Ottawa, the nation's capital and technically second largest city in Ontario. We're going to come back to that. But all this ties into the greater problem of chronic underfunding as well as spending cuts over the many decades, which again is the fault of liberal and conservative governments, right? So it's not just, oh, the conservatives are so bad for doing this. It's also the liberals. Let's be crystal clear on that here. And so what ends up happening, right, is over time, especially due to inflation and the cost of living increases, is that what looks like, oh yeah, no, see, we're adding another, 200 million. But in terms of like the actual catch up needed to bring it up to snuff, it means that it's really like either just keeping steady or in many cases going down as a per capita rate of spending. And so the unfortunate reality is that in 2019, Canada had 4.4 fewer hospital beds per 1,000 residents than we had in 1976. That is a staggering drop in capacity, and it should horrify every single Canadian and make them question why they are voting for different parties that have allowed for it to get to this point. Whether that's, the, oh no, see, we need to, add for privatized healthcare, like the conservatives, or saying, no, see, we actually totally love our public healthcare, but, we still got to be responsible with the people's money, allegedly liberals, right? So whoever you voted for, Team Red or Team Blue, the end result is the same, which is the crippling of healthcare infrastructure. Meanwhile, on January 9th, the day after that was pointed out to everyone, we got a grim reminder of how unfair the system is. 4,888,140 CEWS claims for a total value of $99.13 billion. Sorting through these claims, we see that nearly all of these businesses would have survived without this subsidy. The CEO payouts that resulted are being met with increased premiums on employees for 2022. Yeah, that whole CEWS thing that was meant to support workers and allow people to, keep on their workers. And again, as I've mentioned before in several videos, that was meant for small businesses. A lot of really large, massive companies also said, no, come on, we need that help too. And they took that money, which again, cumulatively is billions of dollars, and yet they still fired employees and just gave themselves bonuses and stock buybacks for, the benefit of them and their shareholders. That's how fucked up the system is. And again, those businesses would have survived. Meanwhile, on January 9th, Toronto Paramedic Union issues warning after no ambulances were available to respond to life-threatening call. Hey, yeah, remember how, according to this timeline, just 2 days earlier, there was someone saying, no, the city of Toronto's totally fine. And then literally 48 hours later, it was so clearly shown that it was not. Like, all these bad people and bad actors need to face jail time, in my opinion. Especially since, due to the problems, and again, this was in early January, right? Due to the skyrocketing cases and lack of workers in a great many industries and pandemics and healthcare workers and people having to isolate because of, again, the virality of Omicron, it resulted in the following horrifying news. January 10th, William Osler Health says that due to extreme staffing issues, the urgent care center at Peel Memorial Centre in Brampton has to cease operations effective immediately. Which, for context, this is scary. Peel Memorial's urgent care center is temporarily closing. This leaves Brampton Civics ER as the only place in our city of 700,000 plus people to get any urgent care. Folks are worried. What if their loved ones can't get access to the help they need in a crisis? Yeah, it's almost like this is a problem of our own making by continuing to vote for two terrible parties. Maybe we should, stop doing that. However, again, by this point in time, right, we had the lockdown in like late December, and then, we're going for, 2 or 3 weeks lockdown. And so they start talking about reopening schools mid-January, which some people had some thoughts about. Paramedics in Ontario are like, we're literally so fucked we can't take emergency calls. Cancer surgeries have already been canceled. The CDC says, but seriously, kids who get COVID have a drastically increased risk of developing diabetes, and Doug Ford is reopening schools. Yep, because, gotta get the parents back to work, and they can't do that when they have their kids at home and trying to manage them and keep them focused on online learning while the parents are trying to work from home if they're lucky enough to do so. And, it's just hard on everyone, and we're just really tired of 2 years of the pandemic, even though we haven't done the right and drastic enough steps, especially globally, to actually get a handle on this. I wonder if these things are connected at all. Meanwhile, on January 11th, Jacobin magazine decided to remind us that Canadian workers suffered under COVID while their bosses made a killing. Yeah, fam, we know. So we've talked a lot about Ontario and a little bit about BC, so now it's time to talk about Manitoba, another conservative hellscape province in this country. On January 12th, this is what the people of Manitoba woke up to. It's up to Manitobans to look after themselves, Premier Stephenson. The fact that our Premier uttered these words today after her complete and total failure to do anything to increase capacity within our healthcare system is unfathomable. PCs are gambling with our lives. I mean, yeah, because capitalism is a death cult. But also, the Manitoba PC government decided to say, yeah, you know what, you just gotta live with it. Like, literally, that's what they said. It is here to stay. Manitoba Public Health says everyone will likely be exposed to COVID-19 in the coming weeks. It doesn't have to be that way, though, and that's a fucking problem. Because as we've seen up until this point, right, the viral spread of Omicron results in, just because of the pure aggregate numbers, higher hospitalizations and people in the ICU, which means, oh, look, now we have to shut down again. Oh, we're so tired of the shutdowns. Well, then start doing the right things. God fucking damn it, right? But on top of that, right, it means people who need actual help and are in like terminal conditions in terms of needing operations to have a shot at saving their lives are having their life-saving surgeries postponed indefinitely. Ontario woman with stage 4 colon cancer has life-saving surgery postponed indefinitely. I really fucking hate being right about so many things when I don't need to be. Which again, right, that was news that came out as the government was saying, yeah, we're going to reopen the schools and everything. While Omicron is still going around and we're not actually, you know, testing people or properly protecting classrooms or, you know, counting case numbers and stuff. We'd rather pretend this problem doesn't exist anymore. Ontario is about to mass infect its kids with COVID. It is blowing my mind we are choosing this route now when so many kids are unprotected and when we have vaccines to protect them. The peak of the highest wave in the pandemic is not the time to return to school. It is immoral. Which, I mean, yes, technically true, but since when did Doug Ford and Stephen Lecce and the rest of the Progressive Conservative Party of Ontario give a single goddamn fuck about morality? So that was January 14th, and then the next day on January 15th, we received troubling news out of a study from Japan. According to the BMJ, patients with the Omicron variant of COVID-19 shed virus for longer after symptoms emerge, show data from Japan, potentially jeopardizing hopes that the period of isolation for people testing positive could be shortened. Gee, I wonder why there were suddenly so many people with COVID and having to self-isolate that it caused problems in the supply chain and with grocery stores and with healthcare and so many other things and teachers and schooling, which is another thing we're going to come back to. But, you know, geez, who could have seen this coming? Anyone with 2 spare brain cells to rub together, but unfortunately that's not our leadership. Like, I can't stress enough how utterly broken this system is behind the scenes. I know I've tweeted about it, which is why a bunch of you people should go follow me on Twitter, by the way. But the core concept of everything, right, is that very real humans are reaching very real and understandable breaking points. And because of all the terrible policies that people are trying to enact and maintain in order to keep the engine of capital chugging along merrily, it's resulting in the crumbling of that system because it's just untenable. It's insane. It's not even remotely rational. And so you get stories like this. My PSW friend just got home after 16 hours of working short-staffed in a nursing home. She hasn't even had her breakfast, yet she's been called 11 times if she could go back for extra 4 hours as there is only one PSW for over 50 residents. Why do healthcare workers have to bear this burden? Because people's freedoms are being interfered with and, you know, they really want to go back and get back to normal and go to restaurants and to the gym again. Their comfort and convenience is more important than the health and security of the local province or nation or entire continent or entire planet. Also on January 15th, fave thing in Ontario media right now is how they stopped reporting new cases in headlines round when hospitalizations got as high as case count had been a few weeks before. Sneaky little eugenicists and their funny little tricks. 10,000 new confirmed cases per day, a fraction of the reality. And again, that touches on the main point I'm trying to make in this section, if you want to call it that, about how the system as we've designed it and are trying to maintain it is untenable because it's resulting in so many people being forced out sick, and it's causing the collapse that capital really doesn't want to happen, right? This week, we reported a record high hospitalization in Ontario that is driven by the mild Omicron variant. Today, we reported 43 new deaths related to the virus, and on Monday, we're sending our students back to school. Kind of ironic how people are saying we are turning the tide against Omicron 2 weeks after we stopped testing the vast majority of people. Yeah, isn't that just so wonderful? We clearly have good leadership. That's why, again, as Mike Gibbs points out, we are at nearly 600 ICU cases. Remember when 400 was considered the no-go zone? Yeah, I think people have kind of forgotten that because time is a fuck during the pandemic. But remember how in the early days, like, we gotta shut down because, like, that's too many people in the ICUs. We gotta give our amazing, heroic healthcare and frontline workers, we gotta give them a break and help get this under control. Meanwhile, now we've gotten so callous about the whole thing that it's like, no, come on. Even though that's, a 50% increase of the no-go zone, it's, yeah, do we shut down? I don't know. And meanwhile, there's, as we've already seen a few times, healthcare workers saying, oh my God, please just stop. I would like a break for once in the past 2 years. But nope, we can't have nice things in this timeline. So yeah, that ICU capacity story was on the 16th. So now we've just hit the midway point, or just after the midway point of January. And yeah, unfortunately, things get worse. Here we go. ICU is surging. Several floors on COVID outbreak. Multiple nurses off due to COVID or COVID symptoms. I didn't think it could get worse, but here we are. And this wasn't just in Ontario or BC, right? This was also going on in New Brunswick. Quoting a tweet by Natalie Sturgeon, which says 4 more people have died of COVID-19 in New Brunswick, 9 people since Friday, 38 people in 25 days. The Agent Indian decides to remind us that the pathetic Irving stooge Premier B. Higgs wanted to close ER rooms across the province in 2020 and didn't go through with it because of public outrage. This is the kind of stuff we should have public outrage for, not this stupid Flu Trucks clan in Ottawa right now. And now would be a great time to remind people once again that people who received CERB for a few months ended up with their guaranteed income supplement cut off, while companies with CEOs making an average of $10.9 million per year continue to receive the Canada Emergency Wage Supplement. Capitalism works. In fact, it works so well that on January 18th, we saw this lovely new headline: grocery store closures loom amid labor product shortages. Again, due to the spectacular failure and the lack of containing of Omicron, which resulted in people being off and places being understaffed, which resulted in these problems. And so in reply to that story, Rodney Tory points out, and yet I'm not seeing grocery clerks equipped with N95s to help protect them. I'm not hearing employers giving workers time off to get vaccinated either. Save $1 today, spend $100 tomorrow. We're living to see it. Yeah, unfortunately, we are living to see the spectacular failures of capitalism, and yet that system has so many people so propagandized that they're saying, hope you like your free trial of socialism, and I'm sitting here like, dude, this is literally under capitalism. Like, if Justin Trudeau was actually nearly as much of a socialist or a communist as the right wing thinks he is and love to paint him as, I would actually probably vote for the guy, but instead I don't because he's another neoliberal nightmare ghoul. Which, again, in more depressing news on January 19th, this was also pointed out to us being the general electorate. The biggest news this week that you didn't hear of is this: Canada surpassed 19,000 deaths within residential facilities from COVID-19 outbreaks. For every single death, there are people directly responsible. They're called capitalists. So, that's some lovely news. I wonder what the word is on all the students who, by this point in the timeline, have now gone back to school for a few days. So, how's that going? Kid just texted me from first day back to class. He is wearing N95 and no one asked for the daily screener. Terrific stuff. And the text that she's screen capped from her son says, so 1-0 of what they said is happening. About maybe a quarter of kids have these masks. Most have mask off or under nose. And no one asked me for this thing. So, I see the back to school plan went really swimmingly. And all those implementations that Doug Ford and Stephen Lecce said that they were doing 2 fucking years ago, and then said, okay, no, sorry, so we lied about that, please ignore us, give us the 2 weeks to get this stuff to the teachers now, and it still hasn't happened. Fool me once, shame on you. Fool me twice, shame on me. Fool me 3 times, I don't even want to think about what that looks like and why that happens. When is enough going to be enough for us here in Canada? Please help me figure out the Canadian recipes for revolution. The French one is so easy. Eat bread. For Canadians, it's 3-year plague, plus forced to work sick, plus government misinformation, plus zero affordable housing, plus rampant inflation, plus climate collapse, plus corrupt cops, plus question marks? I don't know. And you know, I think I've talked about it before, but maybe I need to reiterate it again for emphasis. But Canada used to have a very rebellious past that we just kind of sweep under the historical rug of how the many times where there were rebellions against shit fuckery from people at the top. And instead, you know, here we are doing silly things like, oh, we're gonna protest and raise signs, or, you know, I will vote for a different party. That will surely solve the problem this time, right? The 40 plus time will be the actual time that changes it, right? Like, I am begging Canadians at this point to reject modernity and embrace tradition. But now we're getting to the end point, right? We're getting to the final weeks. We're now on January 21st. Yay! The UK government is scrapping COVID passes and face coverings in England. Jesus fucking Christ. To quote Pedrino, fuck, Canada and the US are going to follow. I mean, yeah, probably, as we saw with Canada, or rather Ontario and then a few other provinces adopting the CDC's terrible BS guidelines about, yeah, we can shorten it to 5 days. Please ignore the fact that this came at the suggestion of the Delta CEO. Meanwhile, also on January 21st, it came to people's attention that nearly 60% of Canadians find it difficult to feed their families, according to a poll. That just really adds to the whole thing of, when is enough going to be enough for us? And we demand, like, actually demand better from our leaders, and not stupid stuff again like the flu trucks clown, like, no, vaccine mandate's bad. I'm talking about real stuff like, actually help the people that, you know, you derive your power and influence from, at least allegedly, right? But instead, we have people becoming increasingly exasperated. And it's not that I don't understand, but as this person rightly points out, the pandemic doesn't end just because you're tired of it. This all was so avoidable, and yet it's still the lived reality because the interests of capital were placed above the interests of people. We're at the stage of the pandemic where people who have been cautious about COVID are dropping dead of heart attacks, which in normal times would have been detected and treated through regular checkups. My friend is suddenly widowed. A sweet toddler has lost his doting dad. At one Ontario hospital, staffing shortages are so bad due to Omicron that kitchen staff have been called up to assist nurses. There are so many COVID patients that paramedics are helping in the emergency room. Does this still sound like Omicron is mild to you? This is why the absolute failure of the media should be talked about here, where the media decided to parrot a lot of the same points, because again, most media is corporately owned. So they said things like, you know, is it mild? Yeah, maybe, you know, how you can protect yourself, you know, which N95 and like which masks to use and for how long can you use them? Trying to kind of, you know, rationalize, maybe just kind of beginning to live with this thing that we shouldn't actually have to live with. This is entirely beatable. We've seen it with some other nations. But instead, in the interests of business and capital and the economy, which isn't a goddamn person, by the way, we are now seeing horror stories like this. Triaged patient dies while awaiting treatment inside Red Deer emergency room. That was in Red Deer, Alberta on January 25th, so fairly recently, just a few days ago as of recording. And again, I'm going to take a moment here to pause, right, because that's basically the timeline up until the recent past of where we are and a lot of the terribleness that I just don't also want to rehash that I've brought up in other previous videos. See the pandemic playlist for that. But, you know, this should, you know, rightly fill you with anger and rage, right? And I sort of want to talk about someone else who felt that anger and rage on Twitter, and it's a little Twitter thread. I'm in a bit of a rage, so this thread won't be pretty. I am in a rage at the calculated way the Ford Harris grifters focused on business needs over people throughout the pandemic. I am in a rage because decisions were made which left our eldest and youngest vulnerable. I am in a rage that we are in a place where testing is a luxury while in other jurisdictions it is a vital part of a pandemic response. I am in a rage that there are so many people with no sick leave. I am in a rage that Ford Nation and SF Leche keep tweeting about school safety, yet schools aren't safe. The measures put in place are half-assed and don't do the job. I am in a rage because if they had just done the right thing in 2020, we wouldn't be here now. I am in a rage because they refuse to admit COVID is an aerosol transmitted disease because doing so would force them to put in place far more stringent safety measures. I am in a rage because the Ford Harris cons hoarded money received from the federal government to fight COVID instead of using it for good. I am in a rage because RATs went to businesses rather than people until the Omicron wave forced them to provide RATs to actual people. I am in a rage because of the calculated lies, spreading of misinformation, or withholding of information. The number of times we were told that an iron wall was being built around LTCs by Dr. Fullerton and Rod Phillips, which was bullshit, and the elderly died needlessly. Remember the hundreds of times Stephen Lecce said kids didn't transmit COVID despite overwhelming evidence that asymptomatic transmission of COVID by children was a significant cause of community spread? Full of the rage over that. Full. Now the criminal way the government is ignoring the particularly vulnerable workers providing early childhood education programs is making my head explode with rage. Fix this now. How about the sheer incompetence of the vaccine rollout? If it hadn't been for the competence of regional health units, even when things were dumped on them at the last minute with no info, we'd be scrambling to get jabbed with the first dose still. Initially, I tried to be understanding. I recognized that this was an unprecedented situation without a playbook. But then patterns appeared, ignoring expert advice and science, listening to those who told them what they wanted to do, making tough decisions weeks too late. Giving money to businesses and parents rather than investing in real safety measures, refusing to listen to stakeholder groups but saying they were, putting half measures in place rather than doing the right thing, blaming others for their missteps, willingly ignoring the vulnerable people in society and then crying crocodile tears when these vulnerable people died, hiding when things were bad, photo ops so it looked like they were doing something, shameless self-promotion of their half-assed measures. It is too damn much. People should be outraged. People should be screaming. Instead, they are trying to protect themselves and their loved ones from dying at the hands of a government that doesn't give a shit so long as the factories are open. June 2nd can't come soon enough. And I get it, right? I'm right there with them, with that rage. But I want to talk about that last line. But June 2nd can't come soon enough. That is the supposed election date for Ontario's provincial election, where people are hoping to oust Doug Ford. But here's the problem, right? Because of our garbage first past the post system, the most likely scenarios are that he, remains in power, potentially with a minority, or a new party, probably the Liberals, unfortunately, get into power. And again, right, as I pointed out, both parties, Team Red and Team Blue, both provincially and federally, have allowed the whole situation to get this bad in the first place over like 40 plus years. As Boudreaux said earlier, we can't vote our way out of this pandemic. What, are we all seriously expecting we're going to rage at the ballot box? And yes, democracy is important. Electoralism is a tool in the progressive/left-wing toolkit, but it's only part of the toolkit. And as we've seen over the course of this pandemic, the parties, by and large, are bought and paid for by neoliberal capitalist interests. So just changing the color and the other side of the neoliberal coin isn't going to actually fix these systemic problems. And yet, this guy is right about just about everything else. We should all be outraged, and we all clearly are, and we're so tired and exasperated about this whole pandemic. But changing the color and the banner of the government isn't going to fix that when they are part of the direct source of problems that led to this happening. So where can we put our rage? Where can we put our energy? Where can we put our focus? What is there to do in a nightmare scenario like this, where governments, whether they are, supposedly left-wing and progressive, like the BC NDP, which we've seen, that's definitely not the case, or you live in a conservative nightmare province, and the Liberals are just saying things like, yeah, well, we're totally going to get a handle on it. Meanwhile, you look south of the border at Biden's America, and that really hasn't been the case. So what is to be done?
Let's fucking go. I do not see nearly enough revolutionary optimism on my For You page that I should be. Western leftists just believe in too much nihilism, and that's it. This is why I always try to post about stuff that I do in real life. Because the fact of the matter is that a lot of Western leftists do not organize. And aside from it obviously being important because it addresses the material conditions of the working class, it will lend you so much revolutionary optimism. You will meet so many comrades that spend every single waking minute of their lives trying to help others or thinking of ways to help others. We can absolutely spend all day complaining about how no revolution is going to happen in our lifetime, or you can organize and make someone's life better today. Why sit and wait around and complain for an armed insurrection when the masses are just not there yet? Go defend people from evictions, feed your neighbors, offer an ear for them to talk to. The community you meet and make will give you so much optimism.
That is what we can do. We can actually take the time to begin organizing within our local communities. I can't do that for everyone. I can offer, sure, some suggestions like, instead of like the trucker convoy doing things, we're not leaving till, they end the vaccine mandates. We can maybe do a similar kind of occupational movement, like occupy places and legislatures and protest places and businesses, especially, the really wealthy jackasses. Maybe do some real serious nonviolent direct action so that we become just such a nuisance and in such large numbers across the country that, things kind of need to happen. As we saw before in previous protests, rail blockades were remarkably effective. Maybe we should also do that at like main ports of entry and like, I don't know, airports or something. Anyway, these are just some spitballing ideas, and maybe we should actually hold our politicians to account by working with local communities and organizations, of which I'm sure there are many in your cities. I just don't know what they are because there's so many cities around the world. And work with them to see, hey, maybe we should start pressuring and asking more of our politicians, and then create lists of, oh, these are people who we should support in the upcoming election, or we shouldn't support, or people just realize, oh, you know what? Whole system's a scam. I'm just going to work with other revolutionary people in my community, and that's going to give me some of that good old crucial hopium. Because that's what people did at the start of this pandemic, right? People knuckled down and they got closer with their community. Places retooled to start making like hand sanitizer, handmade masks. Grannies were knitting up a storm for people to, be warmer in cold weather because they couldn't go shopping and stuff. Like, so many people tried to find ways of helping while still being safe, right? And if our governments have just abdicated all responsibility, then, in a way that's a, quote, good thing in terms of the silver lining being that, okay, so then that means they also abandon their legitimacy to lead, and we should take care of ourselves and our communities. And I'm seeing people do that. If paramedics aren't available, for example, I've seen and heard of some people volunteering to, like they put a little screen in their backseat or whatever, and they volunteer to drive people to hospitals if they suffer like minor injuries but still need to go to a hospital somewhere if paramedics aren't available to, come all the way out there. It's crucial that we take care of each other, and you need to organize with just people in your local community. It's one of the things I've started trying to do more of IRL, especially since moving, whether that's joining my local community association or working with like a small group of people to do whatever it is, like run a veggie patch, for instance. Like, there is stuff we can do that gives us some of that good hope and optimism for the future and reminds us that our fellow man is not so bad, but it's the systems we are forced to operate in and the propaganda that many of our fellow, people in our communities are unfortunately subjected to and then comply with. That is a core part of the bigger problem. Keep your friends and family close. Work with them. Take stock of what you have and find some way to help. It doesn't have to be big because, we're not all going to save the world, right? We're not going to all have an opportunity to run into a burning building and save, a dozen orphans, right? That's not how real life works. But just even one small, consistent act of kindness or generosity can not only really help those people, but it's a beautiful reminder that, we can actually do this, and that whether it's in a smaller way or a bigger way, whether it's with fundraising or forming a mutual aid network or, helping drive people or run errands for them, there are so many ways in which we can help people and our communities get through this, because our leaders clearly show absolutely zero interest in meaningfully doing that. We've seen more leadership from students and the youth and just your regular common average Joe and Jane than we have from supposed people in power who are dictating to us what to do or what we should do, which is again under poor guidance as influenced by capitalist elites. it doesn't have to be this way. It didn't have to be this way. And there is a way out of this pandemic, but unfortunately, those with the power and influence and the means of doing so are not keen on doing that. And that's what's bothering me today.